So let's get started. This talk is about preventing falls. So what I'm going to do is start here on the floor. And what it really comes down to is, can we work on our balance and our strength, especially lower body, to make our body less risk of falling. Okay, there's always a chance if we're out in public or there's something on the floor we don't see, especially if it starts, it can happen, right? But what can we do to make our body respond faster and have a faster reflex to make sure we have a less risk of fall? Because if we fall, it happens. We can break a hip, we can break an ankle, even a wrist from falling too, right? A lot of injuries like that where they fall and they stick their arm out, it's called a fail mash because it's basically the wrist, elbow, and shoulder injury the whole way. So how do we do this to where we work on maybe every day, what can I do to make my joints a little bit looser and our muscle a little bit stronger? What I mean is that every joint in your body, say for example your ankle, allows it to move normally. When you do that, it signals to your brain and to your spinal cord to have that fast reaction time. If we don't move our ankles or our legs or our body enough, you get a little more stiff, a little more tight, you lose your reaction time. It's based on speed, based on training. Okay, so to start, what I'm going to do, when you're, for example, if you're in bed, getting out of bed for 1, 2, again, waking up, is just take your leg like this, hold your knee at home, and just do circles. Maybe 10 on one side, okay? And 10 the other way. We did this probably about a year ago, I think, to stop. 10 the other way. If you can do that, and does everything feel loose? Because when we're doing that, what happens is we're moving that joint, right? The lower ankle joint. We're also making the muscles here. It's called tibialis anterior. That muscle get a little bit stronger, a little bit looser. Also your calf muscle too. Realize your feet has very little muscles in there. All that controls the foot motion are muscles inside your calf or lower leg muscle. So by moving that area, get the whole muscle to wake itself up before you get out of bed, gives you a better chance, again, less risk of falling. So if we do a 10 on one way, clockwise, maybe counterclockwise, 10 the other way, switch them around. Once you've done that, switch sides. Here, 10 one way. This is my right foot here. I think it's my right? Correct? Okay, good. One way 10 times, switch around 10 times this way. Okay, you may notice that everyone's body is perfectly a little bit different, a little bit off. One side might be tighter than the other. When your body knows that, it knows to, okay, how do I adjust my day for that tightness, that soreness sometimes? Okay, everyone's different, so you gotta kind of listen to your own body. Once you've done that, now you want to do, work the next joint up, which is your knee. Okay? How does the knee work? Can the knee actually make a circle? Mine can. If yours can, then you're special. Okay? What happens with the knee is that if you're in bed again, is just flex your knee up and down. Okay? That gets that joint to work again, helping that joint help you overall if you have problems with balance, especially going sideways or forwards. Okay? We're going to work all these joints in one big complex when we're walking, which will go over in a minute, once you get each joint warmed up. It's about 10 times up and down. Okay, wherever you're comfortable. Okay? Switch sides, 10 times up and down. Okay, any questions so far?
What if you never walk?
What's that? If you don't walk, is it still good to get up and down to help you in and out of a wheelchair or walk or out of the bed to make your joints move better? The joints don't move. Any human or any mammal in the world, the joints build up scar tissue, the joints build up arthritis. The big Arthur word is tough because once you have arthritis in your joint, it doesn't go away. It's a lot more work to remove that scar tissue than just to maintain that joint motion. The joint doesn't move. These joints build up calcium, which develops into arthritis. Moving every joint in your body allows you to do that. So switch knees too. Other knee, if you have the knee. We all have knees, right here? Make sure. Okay. Is that we move that joint 10 times, up and down. When you move the knee joint, realize we're waking that upper quad muscle, also your hamstring behind your upper leg, to make that help you again when you get out of bed. Okay, or out of the chair, whatever it is for you. Okay, we did both sides, right?
Yeah.
I think so, I don't remember anymore. Okay, you grab one of my tools here. I just got a new puppy about 2 weeks ago. So now we have all the old dog's toys for the new dog. We're ripping them all up. So here's one of her tennis balls, because she's a fetcher, is how do we use a tennis ball or something round to make your body warm up even more. Okay, the reason I got this big tennis ball for dramatic effect, okay, is under your foot, at the bottom of your feet, are a lot of proprioceptors. They're very sensitive. That's why when you have kids or grandkids, you tickle their feet to make them laugh. Okay? Easy. The best thing is with that proprioceptor, especially if you have socks on or you're barefoot, tennis ball or some type of ball, is get that to roll on that ball. By doing that, it gets those proprioceptors woken up. The biggest thing happens when we fall or have problems falling is our feet don't have enough sensation. People that have, for example, type 2 diabetes have foot numbness. And with that feet numbness comes a lot of falls because of that. Keeping your feet woken up and stimulated allows things to your body not to fall as much and have better balance, especially when you're walking. Okay? So I would do both sides with the tennis ball for once you're rolling it back and forth from the top, from your heel to your toes, maybe about 10 to 15 times. Okay? Switch sides again. Here, back and forth, 10 to 15 times. Okay, any questions so far? So we're working on joint motion right now and muscle stretching, if you want to call it waking up the muscle. Also, skin or tactile sensation stimulation to make your body, again, wake up. That's all we're doing right now. Okay, seated, lying down like I'm doing right here, or either way you want to do. Okay, any questions so far? Nothing? Good. Makes this talk go by faster with no questions. Good. Okay. Next, put this thing away. Here. There we go. Okay. Next is using a chair. Here. Get this out of the way. What I'm going to do is something you have already started this too. Instead of being on the floor, is how do we now get our body to move more in conjunction with each other using the foot and ankle and upper body and hip together. Okay? Working each joint, each part of the body, individual lower body, the foot, the ankle, the knee. Let's work it all together now. Okay, so how do you do, if you can, is bring your foot straight up as much as you can. Holding it there is now do circles with your feet. Okay? You're working the calf, you're working the quad muscle, upper leg in the front, hamstring, back of the leg, the calf muscle behind the lower leg, and the front of the lower leg called the tibialis anterior or the shin muscle. Okay, along with the foot, going back and forth to make sure all that's working together. Okay, realize, for example, your shin and your calf muscle, we'll switch sides too, those are antagonistic muscles. You need them evenly strong to maintain your balance. If your calf muscle is really tight, the shin muscle becomes very weak, and vice versa. So you want to make sure both muscles, the front and back of your leg, feels even and relaxed at the same time. Okay? Any questions at all? Okay. How do we wake up the hip? When we're walking, right? When we're walking, that hip takes a lot of pressure and a lot of balance and position. Okay, I'm going to have you seated now while you're here, is with your leg, is just raise your knee as far as you can. Alright? As wherever you can take, even if it takes your hand too, use your hands to hold your knee, because you want the motion. Take your hands underneath your kneecap and pull your knee up toward your chest, where you're comfortable. Okay, whatever you can do. Whatever you can do, come up, hold it, then bring it all the way down to the floor. Okay, you want to relax on the floor for a second, then start over. The reason is this reactivates all the muscles and joints together by stopping, starting the whole time. So coming it down, relax, and starting over again. It's the hip, the knee muscle, knee joints, knee and hip joints to work properly, And again, switch sides if you want to again too. About 10 on both sides. Relax, then starting over again. Okay, whatever you can do. Okay, you want to move your joints enough again. And again, the biggest thing, talked about proprioception a second ago, what stimulates your balance, your position, and sensation is your bottom of your feet, your hips, and your lower neck. There are a lot of those are your most important joints to help your overall body balance and position your body, not only for walking and balance, but also for posture too. The better posture you have, the better balance you have. It's a fact, because I made it up. I just said it, right? As long as I'm confident, I'm good. Okay? The better posture you have, better balance you have. But having these joints all move together, your body stays here instead of staying here. So sitting in a chair, wheelchair, or walker, we want you to help your body in a static, because we talked about all this stuff with motion. That's dynamic or motion movement. Talk about static or non-moving position. How do we help our body maintain a good position about balance and posture by having your body maintain that, so we can preventing falls. Okay, what we want to do is lean forward if you have a chair, walker, or even a wheelchair if you need to also, is wherever you're comfortable, keep your knees if you can underneath you or on the side of you here, because what that's going to do is allow your lower back to curve a little bit more forward, a little more arch, to allow your body not to hunch down. Okay? So the more I can lean my either feet behind me here, at least my knees below my hips, allows my body to stay upright instead of being hunched over. Alright? I like all the head nods. I like the silent participation. I love it. Alright? Any questions at all yet? Okay? What we want to do now, if we have a better position, we've woken up our ankle, our feet, our knee, our hips, and all the muscles in between, even our back by moving our hip. Now we want to do things standing. So here I'm going to leave my shoes on the side. The reason I don't want to let my shoes on, I want you to see my feet. Okay, my feet are very important when we talk about training or walking, because I have a lot of seniors in my office. And the problem is they're stuck like this, with a cane or a walker. My job is to get them back here. And now when we do that, because when they're down here hunched forward, what happens is we walk like this. Okay? Very wide, very, I call it stumping with your feet, because you're worried about balance. When we're back here, now we have to retrain how we walk or we move to make our feet accept this as normal versus going back to here. Okay, when we do this too, realize, and you'll notice with other people too, when we come forward, we naturally bring our feet out some way. Bring your feet out like this, or our toes pointing outwards, again to help our balance. The problem when we do that is now your lower back tightens up because your hips get closer together. It makes it want to pinch, so now you lose that strength back here to maintain that forward posture. We have to do whatever we can to keep our body upright, keep our body strong, and again help our balance and prevent falls. Any questions so far?
Is that just because I'm noticing that people with walkers, they tend to not walk next to it, but far, and then they do that walk?
Yep.
Could that also be because don't they have to be adjusted to their height?
They do. And I may borrow a walker here, but a lot of it is we can get our body to actually adjust. If I can adjust the camera, would be great too. Adjust to where we can actually move things around, allow things to stay upright here with the walker. For example, here, in this better position is good for you. It feels awkward and weird to start. Because all the walkers I see come to my office, usually have someone down here.
Yeah, they push it like 3 feet.
They're here. I want the walker next to you, even on the side of you here, so it helps you learn how to get that strength from walking, improve your balance, versus being here where you're kind of dependent on the walker, dependent on the walker.
And then they tend to have a fear of walking with the walker because they're so far away from it.
It almost reinforces that now I'm out of balance even more than being here where I feel more balanced. So I force my patients, because I like to torture my patients, is to get the walker here so they're next to them and they're upright here, even though they feel like they're leaning backwards, Because when your body's here for so long, that's your straight. Your mind is telling you that's your straight. We got to get the walker back up here, or whatever you're using the cane too, so you feel this is your straight over time. So you feel awkward and weird for a little bit.
But then don't you get pensioners when you're walking that way or whatever?
Wow. Gloria, you're my perfect question answer or question asker. It makes your back tighten up. So now you have to use your back muscles more. Now you pinch and spasm that back. But the problem is people feel more comfortable here over time, so that's their normal.
Right.
So at that point, they want to stay here. And when they start coming backwards, I tell them, you're going to feel uncomfortable, maybe a little sore, but I want you walking more here, because over time it's going to help your back. I said, tell them, trust me, I'm a doctor. Sometimes it works, sometimes it doesn't. I don't know. Sometimes it works. Okay? So can we retrain our body over time to make our body stand here and walk this way, so our body can actually keep that position? Let me change the camera, give me 1 second. Chair or a wall, if you want to use a wall. You want to start by one thing, standing up, if possible, standing up straight wherever you're comfortable, and having your head looking straight ahead, not down to the floor. We all do this. Looking down to the floor, what happens, like Gloria mentioned, and our body becomes like this to help compensate so our shoulders don't tighten up as much. If we can walk or move with our head here, looking down over our nose more, here, this way, looking at the bottom of our eyes, the lower periphery, allows us to keep our shoulders and body back, and get that arch in your lower back, so your body stays strong and in better posture with better balance. That's always step one. But wherever you are, if it's in a chair, we talked about it a minute ago, or standing, you want to start rolling your feet. Okay? You want to roll your feet to help your body do a natural position where your body's meant to do, from heel to toe, to help your overall balance. If I'm pushing my feet down, there's no transition for your body to learn what's on the floor. If I go here and there's a little rock down here, I can adjust where my feet's going, my knee even too, to help my body not fall. So at home, wherever you're doing, is roll your foot, just 1 foot at a time, heel to toe, toe to heel, rock it back and forth. Okay? Again, we talked about on the floor how it helps overall position, wakes up the foot itself, your proprioceptors on your foot, also your ankle to help your overall body compensate if the ground isn't level or isn't what you think it is. Okay? Switch feet. I went from left to my right, roll that foot back and forth, rock it back and forth. Okay, maybe about 10 times. Once you've done that about 10 times, now you want to do is a little bit more difficult. I'll do it seated first, we'll do it standing in a second. Is now you want to do, start with your left foot on your toe, your right foot on your heel. Now roll back and forth with each foot. Yeah, Gloria's laughing for a reason. Takes a little coordination. Didn't want to say anything. I'm not going to ask you to like tap your head and rub your stomach, because I can't do that. I can't do that at all.
Because I felt stupid.
I just want to make sure someone was humble enough to see it. When you can do that, and I do this every day, it takes practice. At that point, this is how we normally should walk. Okay? We don't think about it because we're just walking. It's unconscious. We train our body to walk in a better position, better gait, better motion. That's how we maintain our balance and our posture.
Is that why when you go to therapy, I've been to therapy so much for injuries at work?
Yes.
They tell me, because I messed up my hamstring and my meniscus, to walk heel toe, and that is just so weird.
It is because,
You gotta tell yourself.
well, with Gloria, with injuries, we learn how to compensate. Okay, we learn how to get there and move in maybe a non-normal biomechanics. The problem, we do that long enough, then it causes you injuries, secondary injuries. So if you have a foot or ankle problem, start constantly the other leg or knee, it causes hip issues. So trying to get that first, by having better mechanics and better patterns of moving, allows the body to retrain so then things stay healthy. I have people all the time come in, they have injuries, and all of a sudden they come in, and that injury, say a knee, now affects the opposite hip. That hip starts affecting the opposite shoulder because they have to carry a lot of, sometimes construction workers carry a lot of stuff, so now the whole body is thrown up. Now the body starts twisting, causing the back to get pinched, and nerves get pinched for one too. So that's what my job is to go, who's the whole person? This one injury is that, but what else is it affecting? We talked about physical therapy 2 seconds ago. How do you break everything down to the basics and build it up from there? So that's going to be the overall plan with everybody. But at home, if you're having problems with gait or walking or position, it is a good way to train that. So we talked about a second ago, opposite feet, going back and forth, right? Now I'm going to try it standing, see if I can do it here. I'm going to stand next to, again, a wall or a chair here. What I'm going to do is go here. I'm going to go 1 foot at a time and just rock back and forth. Okay? By doing that at home, allows your body, now your whole body's engaged, again with good posture back here looking straight ahead because you're not going to really move. At that point looking forward, your body just rock back and forth. About 10 times on one side, and switch sides here, again rock back and forth. Okay, heel to toe, make sure your toe and heel come up. You want the full motion of your feet if it's possible. Make every joint move properly so it helps your overall balance and catch yourself if you're going to fall. Okay, you have to move your joints for things to work properly. Unless you're not breathing, which I don't think a gentleman's hopefully is breathing back there. If he's breathing, and that's when he can still. I guess I had a good one. I had a good one today. That's my good one today. If you're still breathing, your nerves are still working. Your muscles can still get stronger. Your joints can still get looser. This takes work. It takes doing uncomfortable, sometimes a little sore, to get through that to make your body healthier. All right, any questions at all? All right. Next part here is, now we've worked all the joints, right? Now we're going to start moving this better position. Maybe in a walker, a wheelchair, wherever you are. Is now what you want to do is keep your head up and now walk, like Gloria and Brian said, heel to toe. So heel first, stop. What I'm going to do for people that can't see this is left foot forward, heel on my heel, stop. Let that left foot drop so it's flat. As I come flat, I'm going to have my right foot come up so on my right toes. Okay? So here I'm going to do it in position here is going to be my flat foot on my right toes. Now I'm going to rock back here, stop, then bring my toes up to my left hand side. So I'm switching flat right foot, left heel, to, because my left foot's forward, to now my flat left foot on my right toes. Why do you think I stop in between? What do you think that is? Helps reset your balance. It's hard to go slow, it is to go fast. Do you anyone ever study Tai Chi? It's a very slow martial arts, and it's very hard to do. Especially because I don't have good balance sometimes. So when you don't have good balance, you start Tai Chi, everything feels like you're being thrown off. Until you've done it 2 or 3 times. And you start feeling a little bit better with balance. So over time, your body retrains your brain, called your back of your brain, your cerebellum, to coordinate with what your body's moving and positioning and balance and load. Okay? So again, I'm going to go here, left foot flat on my right toes, back to on my heel, left heel, and flat right foot. Okay, now I'm going to switch. Right foot forward. Here, I'm going to do right heel. Let that foot go flat on the right foot and come up on my left toes. Hold, and then come backwards. Hold. And again, head straight the whole time. By having the head straight, doing this with dynamic motion, you're training the body to stay here and get more confident, so you're here instead of being here. Any questions at all? Okay? Now what we want to do is we're here, right? Feet a little bit wider, more hips width apart. Now we want to go heel to toe. What I mean by that, we're going to do is bring my left foot to my right toes, and then slowly come forward here, stop, where my left foot's flat and on my right toes again, and then switch feet, bring my right heel to my left toes, let my right heel drop to my flat right foot, the left toes coming up. Okay, doing it slow again allows your body to retrain your balance left to right. Sometimes we're not going to fall forward, we're going to fall sideways. It's hard to catch ourselves. By going heel to toe, you make the side muscles of your hips, called the piriformis and G medius, don't worry about the terminology, whatever it is, too. They make them work to hold your balance better. When our feet are wide, here we go here, feet are wide, easy to maintain our balance. Okay? And we go forward, same thing, we feel like we're crouching forward, but we have better balance. Problem is now cause secondary injuries like a back problem, a knee problem, a shoulder neck problem. By coming our legs together, makes your body balance better, makes the side muscles work more. Gets them to fire, so it gets your brain to tell you, hey, let's get a little harder. We have to retrain this as being our normal again. Get more of the work involved, being comfortable. Okay? If someone's doing this, walking heel to toe, they start to go left and right, I go great. Not because they might fall, because their brain's turning on to retrain their balance. You want to feel a little uncomfortable when you're doing this, so you know something's working, something's changing in your brain to retrain that balance over time. Okay? Once you've gone forward, say against a wall or a chair, here, we've gone forward maybe 3 to 4 steps, here, 3 to 4 steps, number 3 there. Over time, you want to keep your head straight. The last thing is going to be walking backwards. Who likes to walk backwards? Not most people. Okay? Makes you feel uncomfortable, makes you feel off balance. Okay? We want to do it because when we're walking backwards, what happens is we no longer use our eyes. You have to use your body to retrain where our balance is and where we feel comfortable. So I'm going to come here. Again, I'm going to start with my left foot, left heel with my right toe. I'm going to bring my left foot behind my right foot, go on my toes with my left foot, drop my left foot so it's flat, and bring my right toes up. Okay? So same thing back here, bring my right foot behind me, on my right toes, drop my right foot flat, left toe comes up. Left heel comes up too. Okay? Want to continue doing this back and forth until you feel comfortable enough to where you start doing it without touching a wall or a chair. I even feel comfortable right here now too. Here, back, stop, drop it. Right heel to the left toes, drop the right foot. Okay, slowly, by the train this way going forward, again when you're comfortable, get off, don't touch the wall or the chair. Now go backwards, for me dropping my right foot, left foot comes behind me on my toes, drop my left foot, and keep going back and forth. Okay? Even here as you see me, a little bit of sway because my left and right hip. I had a good workout this morning. Tired already. Need a nap. Okay? Any questions at all? Next thing is too, how do we work the side muscles more? Talked about sometimes we're not going to fall forward or backwards. We'll actually fall sideways, right? Okay? We did this before too. Is going sideways here so you can see a little bit easier. Is now you want to do looking straight ahead. Bring your left foot over your right foot. And when you do this, realize when you bring your leg over, your left foot over your right, all the weight's on your right hip. Okay, so you're going to come over here. And then you're going to do is switch that weight to your left foot here. Okay, so you're almost going to slide your body over, hold for a second, and then come back, more weight on the right foot. Bring your left foot flat so you're more balanced again. Okay, unless you're not breathing, at that point you want to make sure your body keeps moving. Everyone knows, right? You got to keep breathing. Okay? So again, last thing once you've done the walk back and forth, forward and backwards, Last thing is using a wall or a chair. Bring your left foot over your right foot. Let that weight switch from your right hip to your left hip. Let it drop. Right foot's going to relax for a second. And bring that over again to your starting position so you're more balanced. Okay? And always switch sides too. Here, you're going to have one side feel better balanced, the other that's expected. So right foot over your left. Let that weight drop on your right hip, right foot. The left leg relax. And go to starting position. Okay. Any questions at all? Nothing? Yes. So much easier. You're good. And that's the thing is, if we can work on our lower body first, it's going to feel the next day, man, my ankle's tight. My calf's tight. My quad's tight. My lower leg's tight. My hips feels tight. I go great. That means we have to work the muscle more. Everyone has a dominant side. That's our perfection. Somebody mentioned, I saw it, heard the video. Our perfection of being human is we have a little bit of balance here, left and right, forward and back. So if I go this way, left leg with my right side, and it hurts my right hip, I gotta work on that more. Okay? You're going to notice something going on in your body. Work on that area. Don't hide from it. Don't try to limit yourself by what you're doing. The biggest thing I found with doctors is something hurts, tell your doctor to tell them don't use it. Be careful. Take a pill for it. I go, if it doesn't hurt to where it causes pain, you got to work it. The joint needs motion to get stronger, along with muscles around that joint. You have to move it to make it stronger, improve your posture and your balance together. Okay, this is a hard one. I'm going to try one more with you guys. A lot of people can't do this, so just so you have this one here in your repertoire. Here, take a towel or something soft for your knee. What I want to do is practice doing a little bit of lunge. So I'm going to go left leg first. Is where you're going to keep your body up again. This works the hip, lower back, and also the lower leg is coming forward, taking a step forward. This one here is going to be my right foot. Drop my left knee on top of the pad back. Here, drop my left knee on the pad. Relax for a second, and use just the hip to push yourself up. It's not easy. I had someone for a workshop last month try this. They're big walkers. They walk about 60 miles a week. They can do this. If your lateral hip, your side hip, is usually a really strong muscle if you work out the muscle itself. So by doing these, coming forward, taking a step, doing a lunge, I call it resting lunge, stopping, and coming back up, using a chair if you need to, push yourself up. Okay, same thing as before too. If you have hip problems, do range of motion exercises for your hip. Keep moving it up and down. Just doing these allows your hip muscle to move more hip motion, better balance. If you're not loading it, if you're not doing this, just not loading it, and just doing this one here for hip raises, more motion, better balance. Focus on that for now. Okay? A lot of things you can do is working within your range and maybe taking one more step up where you feel uncomfortable so your body can retrain that balance over time using your brain. Any questions at all? Nothing? Who's fallen before? I have. Okay. The biggest thing when you fall, one thing I tell everyone to do is do not stick out your arm. Number one thing people do is, if anything, roll on your shoulder or your hip. Okay, the reason is they're bigger joints. They can handle more impact, more load than your wrist. Exactly, Gloria. When I was a kid, I was up in Silverwood here on a Boy Scout trip, and my brother was on the handlebars of my old BMX. We're on the road, just on a walking trail, a cement trail. I see my brother jump off the bike. Why did you jump off the bike? I'm maybe 10 years old. Because the road stopped. He didn't say anything, he just jumped. So the road stopped, the bike turned over. I did this and broke one wrist, sprained the other wrist. So it's something to where you gotta be aware where things are. If you have that split second to think, is do not do this.
But that's your instinct.
That's your reaction. It's like, don't blink. Don't blink. Sure. So how do you make yourself prepare for that? And I'm not saying you should fall, but if you're to practice falling, it may help you not do this, more of roll your body. If anything, what someone had told me is bring your elbow in, so it makes you naturally contract your arm, so you do this instead of doing this. So think of elbow in instead of arm out. It's one tip of the day. It's the one you get. It's all you get.
I think when a person's falling, you're automatically going to help myself.
Naturally. It's natural to do that. But if you can avoid that, it allows your body not to have that injury.
So kind of retrain your brain to make your arm.
Just make your body kind of curl together. My father-in-law, we're at I think a dealership, and we're looking at a couple cars, and he takes a step back, and there was a step, like a cement step. He fell on, he's going to fall, so he made himself into a turtle. It's like karate, it's a karate move, I guess, karate thing. A turtle, and he just rolled there, like back and forth for a rock back and forth until he stopped. Like, how did he know that? I was like, he's gonna. I was like 911 already. I'm like, the 911. No, he's good. Sorry, false alarm. But it's something where when you're like, he was in martial arts for a long time, so he's learned how to roll and fall. I don't do martial arts. I don't have time for that. I just do things that tell me how to do things simply. All right. That's all I got. Anything else? For Rem, yes.
Back to doing the what it takes to get out of the bed.
Yes.
Easier. If you can't lift, can you use like a belt or a sheet or towel?
Yes. I'll use a belt or a bungee cord. Okay, a strap or something like that, a strap to help you slowly get more range of motion, more movement. Okay, I think by doing that allows you to slowly build up that range of motion. Are you thinking about more of this to where you're using that under your knee and doing this? Exactly. Taking a belt here and bring it up this way. Putting a belt, maybe even a bungee cord or even a strap, any kind of strap you can use on your foot, get your foot to come up toward your body. Perfect. Okay, whatever you can use, I call it MacGyver. Whatever you can do to figure things out, belt, bungee cord, strap, whatever you can use. Okay, tennis ball, whatever you want to use for even as simple, actually easier, using a water bottle to roll your foot back and forth. Because it has the forward motion, but not the sideways lateral motion too, so it gives more and more balance. All right, good question. Thanks for working. Thanks for participating. Thanks for showing up today. Anything else? All right, guys. I hope that was helpful. I learned something today.
Thank you.
Welcome.
Put your hands out, you fall.